I've found that people think it was an emergency, it's now over. And the example of that comes to mind is my dog was drowning in the pool. They're out now, they're fine. And actually, they're probably not. And many, particularly with chemicals that we use in the pool, dogs that have some kind of drowning episode need to be seen, probably x-rayed.
Definitely.
And supervised and monitored.
Definitely. So that's the importance. So if something's happened and you're unsure, rather just phone your vet and find out than leave it till later. And then we end up with a case that's a lot more difficult to manage.
Welcome back to the Paws Effect Podcast. I'm your host, Dr. Kara, and today we're discussing a crucial aspect of veterinary care: emergency medicine and critical care. If you've ever faced a sudden pet emergency, you know how stressful and confusing it can be. That's why I'm thrilled to have Dr. Xanthe with us today. Dr. Xanthe is a veterinarian who's been working in emergency and critical care, and she's here to shed light on what happens behind the scenes during these pet emergencies, and how vets prioritize these cases, and what pet owners need to know when time is of an essence. This episode will help you feel more prepared if you ever face an emergency with your pet. Welcome, Dr. Xanthe Woycieh. I got this in it right. Thank you. Welcome to the Paws Effect Podcast, and thank you. I've managed to get you in the 3-day period that you are locuming here. I'm so excited. That's great. Thank you for being my guest.
Yeah. Hopefully I have something useful to add.
I'm sure you will. So, you are off to Hong Kong soon to go and spend a year doing some work in a totally different country. Give us some of your background, because you started off as a South African grad.
I'm South African, so obviously studied at Onderstepoort and did my community service here in Durban. So I was working with the rural communities here, and I was kind of the acting state vet. And then I decided I wanted to do some traveling. So my husband and I moved to Scotland, and I did a year doing mixed practice there. And then after a year, it wasn't really working for me, and the hours were really hard. And I decided to make a change, and I got offered a job as an emergency critical care vet, permanently on night shift. So I did sort of 7 days on, 14 days off.
Wow.
And did a bit of locuming around. So I'm now doing small animals, which is not where I saw myself. But and then in Hong Kong, I'll be doing an emergency critical care position. So.
It's your calling, huh?
Well, we'll see.
So I love this, and I'm so grateful that you've agreed to join me today, because I spent the first part of my time at this practice doing just that, emergency medicine and critical care. And I was the night vet for over 8 years, which is crazy. You know, when you talk to anybody about sleep and sleep deprivation, they say you certainly don't want to be doing.
Yeah, it's a challenge, because your circadian rhythm's thrown out, and it can be such a challenge.
But it's a very rewarding position. And I think some people love it and thrive in it, and others go, the stress levels are just too much.
I think the nice thing is it's everything is really exciting. And a lot of cases you do see, you can often see a really positive outcome within the first couple of hours of admitting a patient. So I think for me, it's quite rewarding, and being on nights, you have 7 days of having the same patients that you're dealing with, especially with, some of the more complex cases. So it's really nice to have the time to sort of get to know the patients. I really enjoy the nursing aspect overnight, get more time with them. So I've grown a lot in this position, and I think it's something that I see myself doing for, in the future.
Absolutely. And you never know what to expect to anticipate.
No.
And so a lot of it is sort of dealing with it in the moment. And there are a lot of things that you see that are repetitive, but there's also so much to learn.
And I think it's so important to deal with the basics. So when an animal comes in, you've got your ABCs of emergency. You check the airways. You make sure that check the animal's breathing. Make sure that there's no circulatory deficits. So when they come in, you've got kind of a checklist of things that you go through. And if you simplify it like that, it just helps you take that first step, which is often not very complicated, to stabilize a patient. And then you have the time to work through it and do the more complicated brain work once you've got the animal stable. So I think that's helped me a lot to realize you don't have to do everything within that first 30 minutes. You can just stabilize and then take some time to think and make sure the decisions you're making are good ones.
So it's like you say, initial stabilize and keep them alive, and then a workup over a period of time.
Definitely. So even if a patient is really critical when they arrive, the first things we'll do is the basics. So temperature, pulse, respiration, make sure we get IV access. If there's circulatory deficits, make sure that we correct that. So we, check their blood pressure. If they're dehydrated or in shock, we correct that. And then once the animal's stable, then I can phone the owner and say, this is where we're at, what decision, you let them know sort of the plan of action. And then, we can also make informed decisions with the owner. So I think communication is so important, and not to, lose your head in a situation where you think, oh my gosh, if I don't do something right now, you can get yourself into a bit of a knot and not make the best decisions for the case. So
what do you find most difficult about doing emergency work?
I think owner expectations, but I find that just being really clear and communicating, what my plan is, what the potential negatives are with the case. I think just clear communications really got me out of that. I do find, so my job was, I had one nurse on with me and it was just me. So when I had multiple emergencies coming through, I think that is quite a challenge to try and decide which case I'm going to focus on and trying to stabilize multiple patients and triage. But I find if I go into the waiting room and I explain to people, we've got a really critical dog at the back, are you happy to wait a little bit longer? Most owners are actually really, really lovely and understanding, but it really is, communication is key. So, and I find a lot of people are very understanding and often just don't, their pet and their life is the most important thing, which I completely empathize with. And, but when they realize, okay, there's actually someone else worse off, they're quite happy to wait. So
absolutely.
That's
sometimes
probably
good news when you hear that you can wait.
That's just taken time for me to learn how to do. So when you first start, it's like a deer in the headlights and you think, oh my gosh, I need to juggle all of this at once. And it's just, getting that wisdom on, okay, that patient is actually stable enough to wait half an hour so I can deal with this other case that needs immediate care. So yeah, I think that was probably my biggest learning curve is triage.
Yeah, and multitasking. I mean, I'm the worst multitasker generally, but when it comes to emergency situations, it's amazing how things like kick into place and how you're able to sort of manage.
I'm a list maker, so I just have lists everywhere and little check boxes, and I find having a big whiteboard with all my patients on and is really helpful to stay organized and make sure you don't miss anything. So absolutely. Yeah, I think it's I'm generally quite a law corp human being, so helps me just to keep everything on paper.
So in the interest of obviously the listeners, for them to understand some of, maybe getting a view of what happens behind the scenes, but first of all, let's try and just explain some of the terms that we may use. Yes. And one of them that you just mentioned is triage. What does that mean? So
triage is essentially looking, so if I've got multiple patients coming in, it's basically looking at each case independently and deciding which one is the most urgent. So which one, we'll often look at it in like a time frame. So this one needs to be, it needs immediate care. This is an urgent case. This is a moderately urgent case. So this is something that can wait a little bit. So it's basically prioritizing a case over another case is basically what triage is.
And we're obviously very experienced in terms of being able to do that, and what owners sometimes perceive as, I'm giving a case example here of, say, a laceration. We may look at that and go, it's not bleeding, which means it's not going to be prioritized over, say, the dog that's got breathing difficulties.
Yes.
So people go, but it's a big laceration, that's scary, and it's visually, looks far more serious. But in terms of the urgency of managing
definitely.
it.
So I think it's also so I often have to remind myself, and my mom is somebody who, the sight of blood, she gets really, really upset really quickly. And for her, it's the end of the world when, if the dog's nail gets ripped off and it's bleeding everywhere. For her, that's an emergency. Whereas, just as we said earlier, just communicating with the owner. And I think often just taking the dog to the back and saying, my nurse is going to look after this animal while I'm busy dealing with another patient. It makes the owner feel like, okay, we are actively doing something, because we're experienced, they're not. So for them, that is an emergency and that is really critical. So it really is just about, I think just making sure that you're communicating well with the owners and making sure that they are aware that you are doing something for them, that they're not just sitting there while their animal's bleeding in the
you're
room.
Aware of where
yes,
they are.
Yes, and I'm aware. So I really just find like open communication is just so important, and just explaining expectations. And as I said earlier, the owners are often really, really friendly and willing to wait once you explain to them, this is what we're doing with Fluffy.
It's not knowing.
Yes, no, exactly. It's the fear of the unknown, and I think we take it for granted that we know that laceration is not actually in an area where we need to be worried about the dog bleeding out, or as you said, it's not bleeding. So right now we can put it at the back and it'll be fine. We can sort out, bandage it or stitch it or do whatever a bit later.
Absolutely. So let's talk about some of the common emergencies, particularly that owners may come across, and the kind of potentially either phone calls or cases that we receive during those after hours. So what are the sort of typical cases, just to give some examples?
Sort of on a weekly basis, the cases that I would almost definitely see would be like a blocked cat. So that's when usually a male cat will have a blockage in the urethra, which means that the bladder gets overfilled. And this then can lead to a whole lot of electrolyte derangements, and it is an emergency. So, in that case, an owner at home would notice their animal potentially trying to urinate and not being able to, vocalizing. It can, the animals can be extremely distressed. And that's a case that we see fairly often. That would be one example. A seizuring animal would be another one. So often that's very distressing for owners to see, especially if it's a first time for them. And often with a seizuring case, by the time they get to the clinic, they are asymptomatic by that point. So they've already gone through the seizure phases. And at that point, it's really just about communicating what our diagnostic steps are going to be. So I think those two I definitely see on a weekly basis. Obviously, in South Africa, you often see dog bites. Not something I saw very commonly in the UK. But since I've been locuming in South Africa, I've already done
to dog bites.
Yeah, I've done about 6 or 7 stitch-ups. So, that's also a lot of blood, can be very distressing. But that's a case where you rush it in, but often stabilizing before doing anything is preferable. So I would say those are some fairly common ones.
Hello, I'm Dr. Cara, a veterinarian and the host of the Paws Effect Podcast. Our show is all about enhancing the lives of pets by providing reliable, science-based advice and engaging in discussions with experts in veterinary medicine, pet nutrition, and animal behavior. As a professional with years of experience in both the UK and South Africa, I run a 24-hour veterinary hospital and an online pet store. I'm also pursuing a master's in animal nutrition and consult for UltraPet, a local veterinary-grade pet food manufacturer. My passion lies in sharing knowledge and helping pet owners make informed decisions about their pet companions. The Paws Effect podcast is rapidly growing, attracting a dedicated, engaging audience of pet owners who are passionate about their pets' health and well-being. Our listeners trust us for credible, informative content that empowers them to provide the best care for their animals. We are looking for sponsors who share our commitment to pet health and who want to reach a highly engaged and expanding audience. Partnering with us means aligning your brand with trusted and influential content that resonates deeply with pet owners. As a sponsor, you'll benefit from high visibility on a platform that is used for multiple purposes, including educational content, product recommendations, and community building. We offer various sponsorship packages designed to fit your marketing goals and budget, ensuring that your brand gets the reach and the impact it deserves. Join us in making a difference in the lives of pets and their families. Let's work together to bring valuable insights and quality products to our passionate audience. If you're interested in sponsoring the Paws Effect podcast, please get in touch. I look forward to partnering with you. Before we continue, let's address a critical aspect of pet care, gastric health. Introducing UltraPet's special diet gastric liquid care, formulated to aid pets during recovery from gastrointestinal issues. This versatile product boasts a balanced formulation with 31% protein, 9% fat, and 3% fiber, replenishing key nutrients essential for pets recovering from gastric issues. Featuring a delicious chicken flavor, it is highly palatable, encouraging pets to eat during recovery. I've had great success using this both with tube feeding and syringe feeding patients. What sets this liquid care apart is its comprehensive approach to pet health, with added prebiotics for digestive health and omega-3 and 6 for immune support. It is a holistic solution for upset stomachs. UltraPet's gastric liquid care comes in a 750-gram pack, providing an optimal solution for pets in need. Give it a try and witness the difference it makes to your pet's recovery. Your companions will thank you, and you'll appreciate UltraPet's dedication to pet health. Now let's return to our conversation. I think I want to go into, maybe we can talk a case example.
Yeah.
And I think the bite wounds is quite a good one, because I want to talk about how we communicate with owners in a little bit more depth, because like you say, that explaining, particularly when it comes to cost expectations,
yes,
or managing the sort of the financial constraints. And bite wounds are a great example because, often what you see on the surface is not necessarily what we discover when we go in and surgically manage these cases.
Yes.
So talk us through how you explain to owners and sort of your way of explaining to owners the costs associated with particular care. How do you tend to give them a broad cost estimate, or do you give them options so that they can buy into it or not?
I generally try to give options if I can. I think specifically in this country, because a lot of people don't have pet insurance, it's often coming straight out of the pocket. So I think discussing different options and putting that on the table for them to discuss, ultimately it's their decision. We can give them the gold standard option, and then I think it's always important to have a couple of others, because while the best case scenario is an owner wanting to do the absolute best for their pet and spend, but that can cost, a lot of money. And the problem with bite wounds, especially if you've got crush injury, is those wounds can then break down and it becomes quite a chronic treatment process. So you've got an animal coming back for repeat visits, maybe the skin is breaking down and we've got to go back in and debride. And so it's very difficult to do a cost estimate for bites. Obviously, when they first come in, you are able to see, okay, this is something that possibly would just need a drain placed and it should be okay within 3 days. But the problem is we've got a lot of pit bulls in this country, and they often do that quite crushing bites. And then that can, have long-term consequences. So I think definitely having options available is important, but it also is very difficult to put a number on a bite wound, just because of the chronicity of the condition in some cases.
Absolutely. So. I mean, I found that in particular with some of the hit by cars, the ones that that were very serious bite wound or monkey attack or something, and we would have the conversation right at the start and say, I need to actually know now at the start of this where you're wanting to go in terms of managing this case, because as soon as there's a consultation, the IV line is placed, the initial pain relief is administered, the x-rays are taken, those costs escalate quite quickly. It's quite
so quickly, but there are necessary steps to take. So I think it's important for owners to realize that without, we need to take those steps to make sure that whatever procedures we do are safe and effective, because if you miss something and you are treating inappropriately, you're going to still end up spending the same amount of money, but maybe with inappropriate treatment plans.
Absolutely.
So I definitely agree. And also just getting a figure. So it's sometimes, important to say to owners, how much do you have? And we can try and see what we can do to work with that. So I think also, that's an approach that I would sometimes
and managing expectations.
Definitely managing expectations. So again, just communicating and saying, there is a chance of wound breakdown. This is not a stitch it up and go home, because often dog bites are dirty wounds. So, we need to consider that, post-op, infections after we've seen them are possible. So, it is necessary to put them onto adequate pain control. That's really important, and making sure that they've got antimicrobials on board. And with bite wounds, you can't just stitch it up and can't just close it up. So we need to consider placing drains and everything that goes along with that.
Absolutely, yeah. And sometimes it's literally all you're seeing is the tip of the iceberg. I mean,
exactly,
there is a huge amount of damage under that. What looks like a tiny little laceration.
Exactly. So I mean that's why you're saying with X-rays, it's so important to determine whether there's been any perforation into the body cavity, and all of those little things influence the outcome, and without taking those diagnostic steps, we don't necessarily know what we're dealing with. So that's really important.
Absolutely, and I mean, you speak about owners not necessarily being in the same situation as when you were working in the UK. How did you find you were able to manage those cases where either there were financial plans made or there was an insurance policy in place? How did that sort of impact your ability to manage these cases?
In terms of the difference between how I would respond to a person who's got insurance versus someone who doesn't. So again, it's just what I would usually do is just ask people to be brutally honest with me and say, I know that you would love to do whatever you can for this animal, but realistically you still need to put food on the table. And I am fully aware that there's a lot of people, money is a finite resource. So when you don't have an insurance company to put a claim in for you, I feel like I'm a lot more go back to basics. So I will choose steps that are necessary, but I won't necessarily go for, let's say if we can do a blood smear instead of doing full bloods, and that's all they can afford, but it might give us enough information for us to make an informed decision on treatment plan. I'd rather go for a more simplified diagnostic approach that maybe doesn't cost as much, and sort of work within that to try and get an appropriate treatment plan in place without spending a lot of money on diagnostics. Where spending a lot of money on diagnostics is so helpful because it means we're more targeted in our approach of any specific case. But I do realize not everyone has the resources. So I think that would be, the difference is I think we have a lot more energy to spend on intensive nursing. So with a case that maybe the money's a little bit more, we're being a bit more conservative with money. Often we'll ask owners if they are able to take care at home because then they don't have to pay for hospitalization. And if they are able to do a little bit more on their own, just so they don't have to pay for our time. So yeah, I think that's my main difference really, is just trying to get the best outcome for the pet without spending money on stuff that maybe the owner can provide.
Absolutely. Yeah. No, very, very good points. And in terms of expectations of outcomes. I'm talking, and it's amazing how when things go wrong, those kind of things sit with you. And I'm now talking probably like 14 years down the line. I remember as a relatively new vet doing emergency work, how I received a puppy that had a bone stuck. And I remember this case very clearly because it didn't go to plan. And the owners had tried to remove the bone. And in doing so, unfortunately, damage was done to a part of the throat that I could not visualize. And the bone was removed. And so my communication with the owners was, I think everything will be fine. And of course it wasn't. And unfortunately, that bleeding laceration at the back ended up accumulating in the lungs, and the poor puppy died. And a terrible story to tell, but a reality of what it did to me as a vet in terms of really trying to manage expectations, actually not being as positive or as hopeful, and kind of going, we can never determine outcomes.
And I think when you start out, we fresh and fresh-eyed, bushy-tailed, and you're so excited about making a difference, and you're so optimistic about every single case. So I think it comes with experience, and unfortunately it comes with having those negative cases where you learn a hard lesson, and the next time you go into that case, you end up being extra cautious. So I definitely think that's an experience thing. I do also lean quite heavily on, I will phone somebody who has more experience in a specific case and make sure that I am giving a correct sort of prognosis or expectation. But I think a lot of owners, I tend to lean towards the negative outcomes just to prepare them for the worst, because it may happen, and then rather be pleasantly surprised that the case is turned around and it's a positive outcome. Because I think if we focus too much on the positive and it does go badly, that person's ill prepared, and it often doesn't come from us trying to swindle them or anything like that. It really just comes from us really wanting that outcome for the animal and wanting to make the owner feel better, because we're often dealing with very emotional people, sometimes grieving people, and it is an emotional challenge for us. And I think you have to grow in your emotional intelligence as well as your sort of clinical skill to get to that point where you can give an accurate sort of prognosis or take them through all the possible negatives accurately.
Absolutely. And how do you find it's best to support owners if they are in a complete state when they come in to the practice in an emergency?
So everybody's different, and I've had owners who are lying on the floor crying. I've had very stoic owners that don't really want you to talk about it. So everybody is very different and behaves differently in an emotional situation. So I would definitely handle people differently based on how they arrive. I think it's it's learning interpersonal skills. So generally what I will do is, I want to take control. So if it's let's say we've got a cat, it's not breathing very well, I will immediately, I will have my nurse, if I've got my nurse available, to stay with the owner. If I've got another staff member at the back, so somebody's with them, we'll get somebody to make them tea, communicate with them. As soon as I've stabilized that, I'll let them know we're taking them through to the back, we're stabilizing. As soon as I've got that animal stable, I then either send my nurse, or if I'm able to, go out and say, Fluffy's stable, take a deep breath. And then once I'm just going to go to the back again. And it's, again, communication, and I, having realistic expectations. But it is so difficult because often, like, if you've got I'm the person who, I'm a hugger. So, but you can't just go and hug every every client. It's inappropriate. And some people don't appreciate that. But there are occasions where somebody might really, really need that. And then I will ask them, is it okay if I give you a hug? And so, and that, it is very difficult. And I think it takes somebody with a little bit of emotional intelligence to properly be able to comfort somebody. And, as part of emergency care, we get a lot of euthanasias. So a big part of my job is helping people grieve and say goodbye. And I take a lot of pride in that. And in the UK, they encourage us to do a lot of CPD on grief counseling and that kind of thing. So definitely, I think it's very much up to the individual situation and the personality coming in.
I love that. That's really good. And in terms of you, I mean, that's a stressful position. Like we started with saying, you're working at quite an intense level at extended periods of time. How do you, as an individual, like recharge and not burn out?
Not very well.
Just keep working.
I think it's, when I first started, I think I really struggled because, I think as a career, it attracts A-type personalities. So we drive ourselves really hard. We really want the best for our patients. And as you said, outcomes are not always what we expect. And we carry that around with us. So when I first started, was really struggled. So every time a case didn't quite go according to plan, I would immediately blame myself and say, there was something I did wrong. Mm-hmm. And I found that quite challenging at the start. But in terms of unwinding, I think it's been really important to separate work and home, and not bring work home with me all the time, and have stuff outside of work that is exciting, that enthuses me. And so I think for me, it's having a little bit of a disconnect from work is important, because I drive myself really hard. And if I can go in a thought spiral about a case and wake up at 2:00 in the morning thinking, oh my gosh, I should phone whoever's on. And I messaged you
Even
last night.
I was
thinking about the case that I had, and I thought, I need to phone the night vet and tell them what I'm thinking. Maybe we can change things up. So it's so easy to carry work around with us 24/7. And I'm very passionate, and I think most vets are very passionate. So I think, in terms of unwinding, do I ever really unwind? I don't know.
Might have to have that discussion with your
definitely. I think try and for me, I'm a very outdoorsy person, so try and get out of the house and go hiking, and so that's definitely my exercise is a good way to sort of unwind.
Very good. And in terms of ever evolving, we're very privileged to have, great hospital facilities with everything. But we were discussing, you going to Hong Kong to go and, to the ability to learn new skills and things can only help in terms of managing cases better and better. And that's what we're all striving to do.
And I think it's so important. Like it's a industry, and it's the same as human medicine, and a lot of other areas, where things are constantly evolving. There's always new medicines coming out that are potentially better and have less side effects than the old methods. And I think it's really important to keep learning and to keep upskilling yourself so that that you are you're up to date with the best protocols of the day, and being up to date with new medications that are on the market, because I think it's just so important, and you never stop learning. And there's stuff that I've forgotten from university that I need to constantly be reaffirming in my brain, because we can't retain all the information that in veterinary medicine. It's impossible. I think there's some people that do a great job, but I definitely need constant reaffirmation of certain areas. So never stop learning.
And for pet owners who perhaps haven't ever found themselves in emergency situations with their pets, but in order to like try and help prepare them, what is the general advice that you give in terms of like some practical steps that they can follow if they discover that they need to come in after hours? So what would you say is the right kind of protocol or approach? Do they just rush in? Is it important to phone, for example? What do you find is the best?
So I think if you've got, if you've got an animal that, and obviously everybody's got a different perspective on as we said, a different perspective on what an emergency is. So I definitely always advise phoning in first and getting some advice from whoever's on call. But if your animal, is not breathing at home, it's collapsed, you are extremely concerned that this animal doesn't have time on its side, getting in the car and phoning on your way in and just warning, don't, to rush in, but make sure that there is somebody waiting for you because, we have a whole hospital full of patients and we may have another emergency in, and it's good for us to be able to prepare or redirect you to a practice that maybe has somebody available, if that is an urgent case. So I do think phoning in is very important, but in the same breath, if it is something that where you're concerned this animal may die, something really dramatic, then I think getting in the car and ringing the vet is not the wrong thing to do.
Absolutely. I mean, in many cases from my experience, even if it is a bleeding wound, you can say, put pressure. Sometimes people are in such a panic. So much advice you can give.
There's so many different emergencies. So, if you've got, that's why phoning in for advice is always important. So if you've got, a dog that is bleeding, the best thing to do is to put pressure on the wound and, try and control that bleed on your way in. So that's why, even if you are rushing in, to get on the phone, and if there's things you can do on the way or, before you come. And I often find, especially as we said earlier with a seizuring case, people rush in, by the time they've arrived, the animal's actually, it's up and around, wagging its tail, and then I have to go through, okay, now we can start the diagnostic steps. But in that case, it might have been safer for the dog to have finished seizuring, have me on the line, and then I could have spoken them through it, because not every dog is going to seize persistently, and so it is important to just sort of communicate with your vet and make sure that you're doing the right thing.
And there are situations I've found that people think it was an emergency, it's now over, unlike the seizuring, which is one side. And the example of that comes to mind is my dog was drowning in the pool. They're out now, they're fine, and actually they're probably not. And many, particularly with chemicals that we use in the pool, dogs that have some kind of drowning episode need to be seen, probably x-rayed.
Definitely.
And supervised and monitored.
Definitely. So that's the importance. So if something's happened and you're unsure, rather just phone your vet and find out than leave it till later. And then we end up with a case that's a lot more difficult to manage. So, I definitely, that's just... it's about communication.
Yeah. But I think it's also about, people are sometimes prohibited by costs, especially after hours.
And transport sometimes. I recently had a case where an owner didn't have transport the night before. It was a dog fight. It was quite severe, and there was damage to the respiratory system, and she couldn't get in the day before. So I do understand she had every intention, she really wanted that animal to be seen, and as soon as she could get transport, came in first thing in the morning, which is not ideal, but I do understand there's limitations, and so yes, cost, because after hours does cost more, because we are you working at a time where you do get the pay is higher, but you're also working at hours that nobody else wants to work. So things do cost a little bit more. So yeah, definitely a cause for consideration.
Absolutely. And no, I like now that there is information available out there. One of the main things I saw, not main things, but we saw a lot of vomiting and diarrheas and a lot of, sort of dietary indiscretions and foreign bodies. We live in South Africa where people feed bones and there's a braai and they steal food, but also the gastric torsions where people don't realize that time is actually really
so important.
Yeah, go, my dog's just got a bit of an enlarged abdomen. It should be fine. And they maybe they're outdoor dogs and they don't really see, but by the morning that dog
is in shock. And it's and that's a great example. So we do see so that's GDV, so gastric dilation and volvulus. So these owners often phone in and say, my animal's got a really, really bloated stomach. It looks like in a lot of pain. And often those animals come in and unfortunately the prognosis is quite poor, and it's a very expensive surgery. So, and it is very time sensitive. So those animals can get really ill very quickly and get very shocky very quickly. So you have that definitely. And again, I think it's so easy for somebody to look at their animal and say, oh, it's just got a bit of a grumbly tummy. But if you've got an after hours available and you can phone a vet for advice, I definitely advise it. And also checking, like you were saying earlier, steps to take at home. If you are unsure, you can actually take your dog's heart rate, take its breathing rate, check its color of its gums, and you can speak to a vet over the phone and say, this is, these are things you can feel the heart with your hand and count for 15 seconds. And, you can give your vet that information, and that gives us the ability to say, oh, actually maybe you could wait a little bit and see how they get on for an hour, retake those parameters. And it just helps us. So if you're unsure, I think to keep a calm head and, phone your vet.
Yeah, I mean, definitely the summary of our thing is communication is key.
Definitely.
And I would certainly encourage, and there are obviously now online AI bots that will answer, my dog's got this.
Yes.
And I mean, they do give, I've tested them. Because
the insurance companies also have these televets. So,
yes.
There is all that available.
And there's so much that it will come up with a list of potential causes of the, say, bloated or enlarged stomach. And the bottom line is most of it has to be assessed by us. And the risk of not doing so is quite grave. So I would definitely encourage.
Definitely. And I think it's so difficult, over the phone for us to assess. It is always a challenge. So a lot of the times our recommendation is to come in, and it's not because we are wanting to get money out of people. It's because we really are concerned that this animal may have something more serious going on, and we'd rather see it sooner than later, because it makes our job easier in terms of trying to stabilize that patient and get the best outcome. So I think waiting is not always the best thing. There are always going to be animals that rush in and it's not an emergency, but I'd almost rather see those animals than have an animal that potentially has waited too long and we don't get the chance to try and save them. So I know there's probably, like, if vets are listening to this rolling their eyes like, oh my gosh, we're going to have 15,000 emergencies.
But no,
but I definitely, for me personally, like, I would rather somebody phone me and just find out than, think it's going to be okay and wait until the morning and the patient suffers. So.
And for me, it's what people, like you said before, perceive as an emergency. That is one benefit. And obviously I say it as the owner of a 24-hour hospital, which people will be like, they're in it for the money again. But I would, if people are concerned and they say their dog's itchy skin is an emergency to them and it's causing no one sleeping, then, that is one benefit of having a hospital that remains open 24 hours. If the dog is in distress and it will not be prioritized. If there's a gastric torsion or the vet's in surgery or whatever, there may be a waiting time. But, that is one of the benefits of what,
definitely.
we
and I
as
think
vets
also
can offer.
after hours, you do have people that work all day and they get home and, potentially there's something that, they are unable to get the dog there during work hours because that's a concern for them. So I think we do also see some routine cases after hours that the owner just does not have the time for. So I think that's also not for people to feel guilty about coming in. Yeah,
definitely. Thank you for giving us a bit of an insight into the work that you do. It's
Thanks for your
I think
time.
It's really valuable information, and I think that owners will appreciate that it's given some clarification on what happens behind the scenes, as well as sort of how to prepare and how to manage it if they do end up in an emergency situation.
Yeah.
So all
the
best.
Lucky to have a 24-hour hospital.
Yeah.
So.
Yeah, no, I mean, I'm obviously very passionate about the subject, and I could go on and on because
Definitely.
there are so many case examples and so many things that we see, particularly in South Africa, with snake bites and bee stings.
Oh no, there's so much. It's just an overwhelming. There's a plethora of things that you can see.
Yeah.
I've actually, the biggest change that I've seen, obviously coming back to South Africa from the UK, is we've got all these infectious diseases. So which we've just not been on my radar for the last 2 years. So coming back and there's all the infectious diseases. We've got all the fun parasites. We've got snake bites. It's
crazy.
It's this so much going on.
I was slightly
brain's in
overwhelmed.
overdrive.
So as an Edinburgh graduate coming to South Africa and being like, wow, one of the first things I dealt with in an emergency case here at the practice was a chicken that had been bitten by a dog. And I thought, wow, I'm in for a very interesting career. I haven't seen a chicken here since, but it was a great way of starting my first night shift.
Yeah, I was doing sort of bird flu testing on ostriches, and it's a very interesting job we have.
Yeah, no, and every day is different.
Yeah,
never a dull moment.
No, definitely.
And obviously, just to reiterate that our intentions are good, and we really care about what we do
so much. We have so many sleepless nights over your animals, I love what I do, and it's a pleasure when things do work out, but it's also a pleasure to be there when things haven't worked out, and to provide that comfort and be there for somebody. So no, it's a pleasure.
Absolutely.
Yeah.
Thank you.
Cool. Thanks, Cara.
If you found today's discussion helpful, make sure to follow us for more expert advice on caring for your pets. Remember, in an emergency situation, the best course of action is to stay calm. Contact your nearest veterinary emergency service and trust that what they're doing is everything they can for your pet. If you have any questions about what we've covered today, don't hesitate to reach out to your vet. And as always, thank you for listening to the Paws Effect Podcast. Don't forget to give your pets a big hug from me. Thank you so much, Dr. Xanthe, for sharing your expertise on emergency medicine and critical care. It is clear that handling emergencies is no small task, and you've helped us better understand the importance of triage, the challenges of estimating costs, and the unpredictability of outcomes in these situations. For pet owners, knowing what goes on behind the scenes during an emergency can help reduce some of the stress and confusion in these moments. We appreciate the life-saving work that you and your team do every day. Welcome back to Just for Pets. You're with Dr. Cara.
Hello, Doctor. It's Chanel the Persian. And, I can't seem to stop retching to get this hairball up.
Are you on a special diet?
Excuse me?
Hairball control food will really help. And maybe some Laxapet. And lucky for you, Just for Pets have a big range.
Well, how early can I get some?
Order today, and we'll deliver pronto.
Wow! I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.